Started. Welcome back, everybody. Hope you had an awesome lunch and break, networking, all that good stuff. We are going to trail on. So, the diagnostics industry is standing at an interesting juncture. While tech-based innovations are fueling a revolution in diagnostics, the pandemic also accelerated trends that were already underway. To give us insights into this oh-so-interesting topic, the future of diagnostic testing, we have with us Dr. Dana N. Owens, Chief Medical Officer and Lab Director for the South Carolina locations of P23 Labs. The stage is yours, Doctor. Thank you for being here.
Am I on? Can you guys hear me? All right. Is everybody awake? Everybody having food coma yet? I don't know if that's a good thing or a bad thing to start after lunch. Well, my name is Dana Owens. Just to give you a little bit of history, a little bit of background. I am the clinical lab director for P23 Labs, as well as a chief medical officer. I'll be talking today a little bit about the lab and also emerging trends. My background is I am currently the lead gynecology hospitalist for Advent Health Central Florida Division. So I lead a team of minimally invasive gynecologic surgeons who cover 25 facilities as well as freestanding EDs. So I work with the hospital side as well as the laboratory side. So I have a little bit different perspective on some of the topics we'll talk about. So some of the objectives, I'll tell you a little bit about P23 Labs, what we do, who we are, what we're about. I'll also shift into some of the diagnostic testing and some of the emerging trends that are happening a lot because of COVID-19 or SARS-CoV-2. And also the response that everyone in this industry is going to have to make in order to stay ahead of the game. All right. So P23 Labs, what do? We are a laboratory that deals in complex diagnostic testing. We are based in Savannah, Georgia, as well as we'll be opening soon a new Hilton Head location. Our facility, I'm sorry, the monitor is a little too close. I can't see my slides very well. You can slide it to the right a little bit. Yeah. Sorry. Sorry, technical difficulties. No, push it back a little bit. Thank you. Yep, that's better. So P23 Labs, we offer a full suite of molecular testing and diagnostic tests, including SARS-CoV-2 or for COVID-19. We also look at infectious diseases, respiratory pathogens, as well as women's health. So P23 Labs, we currently employ over 100 individuals. We offer both remote as well as on-site opportunities for our employees. P23 Labs has dedicated programs that offer support to the community in many different ways, and that's a big mission of our organization, to give back as well as engage those communities so that they are ahead with technology as well as testing. Part of our community efforts are we do a big give back to the community. We sponsor for the local surrounding communities as well as our further outreach to communities outside of the South Carolina location. We want to partner with different organizations in different communities as well as especially those minority communities that have poor access to care. And we look to partner with them in order to give back to those communities, and well as partner with local resources to do outreach for us. It's part of our DNA as a company to work and to push the boundaries to get access to minority communities. So what is our focus? Our biggest emphasis right now, and we'll talk more about some of the emerging trends, but we're looking at access for women's health care. We know that there is definitely a gap in women's health, especially with morbidity and mortality in different areas of women's health. We want to practice on engaging the minority communities and other underserved communities that don't have good access. We know that in the United States, this is something that is a big push, not only locally, but nationally. We were founded in 2020. P23 captured on the unique opportunity for a quality lab that focuses on fortifying relationships of our patients and the providers. So, P23 and COVID, or SARS-CoV-2, COVID-19. We were the second laboratory in the country to get emergency use authorization approval from the government for COVID-19 saliva testing. And we were also the first laboratory to receive emergency use authorization for a unsupervised at-home saliva-based testing approved by Health Canada. So, how has this changed diagnostic testing for the future, and some things that we will see happening down the line, especially since this is a room full of innovators and forward thinkers? It's something that we're going to have to look at as far as technology for the healthcare sector, as well as engaging the patient. So, how are things going to change, and how has it changed since COVID? Well, we know that we have more at-home testing. There's more engagement online. People were working from home remotely. People were doing homeschooling. So a lot of things now are online. And with the new generation of late millennials, our Gen Zs and our Gen Alphas, everyone wants immediate results, right? They want access. They want the results as soon as possible. So the world has completely changed since COVID-19. Patients now have telemedicine. They can log on for their appointments. They have access to patient portals so they can look at their results. They can review their documents. Now with the new changes in the laws, patients can have access to their records within 24 hours. Now that the EMR systems are communicating a lot better, patients can get their records from anywhere in the country, no matter what facility that they went to. So the access is critical. And then also just making sure that you have the availability, and this is going to be important. We talked about earlier, one of the speakers talked about access for those communities who don't have the infrastructure, right? So what about those patients in the communities that don't have access to the internet? How are we going to provide that service and get that information to those patients? So, one of the big keys is awareness, right? Awareness to testing. What's available? How can I get it? And how do I get my results? By being able to test at home for COVID-19, it brought the patient awareness not only to the fact that they had access, but also that they should be able to test for others. Why can't they test for other diseases? You know, why just COVID-19? Is there something else that I can do? If I can't get in to see a doctor, is there some other test that I can get done, but have the resource of having a physician available to go over those results with me? There's been a push towards home-based self-collection kits. I'm sure that you've seen some of the commercials. There's now many different products on the market where you can do self-COVID testing. Why not expand that to other disease processes? These are, what's important or what's good about them is these are patient-centric. They're easy to use, and they're friendly. And patients feel more comfortable sometimes being able to get tested with that confidentiality piece. From there, telemedicine services are available to prescribe a treatment plan should the patient be diagnosed with the disease process. So having the ability to partner with a facility of physicians or a suite of physicians who you can reach out to when you have a positive test. The patient logs on for their results. They get referred to a physician or a provider, a healthcare provider that can go over the results with them and make a treatment plan. Makes it much more accessible. So, We know that this is a $6 billion industry, right? At-home diagnostic testing market is expanding. They project that by the year 2027, that this value will be over $6 billion. So there's a large market. For specimen collection, what's nice about it, when you have home testing, you can sample different types of tests. So that can be blood, that can be urine, that can be saliva testing. One of the advantages of saliva testing is it's easy, it's less painful. A lot of patients complain about COVID testing. I can't tell you how many COVID tests I've had working in the hospital facility. We get tested really regularly, and so the nasal swabs are not pleasant. So with saliva testing, it's an easy to obtain sample. It's less painful and it's convenient for the patient. 24-hour access, you have online access to your results. The turnaround time is rapid, so the patient can order their test online. They receive their test kit. They collect their sample. They return it in prepackaged form and send it back to the laboratory. The laboratory runs the specimen, and then the results are uploaded, and the patient has access to that right away. And then again, the instant results. So the patient has access to the portal. Not only do we have a patient portal, but we also partner with to have a client portal of physicians who want to have access to those results. If they request them from the patient, then that provider who is partnered with us has access to those patients' results as well. So what are some of the possibilities for moving forward? What does the future look like for us? When it comes to diagnostic testing, today's consumer or the patient, we know is emboldened, right, by the development as a direct result from COVID-19. We know that patients are looking for something that's easy to use. They're looking for accessibility to that product. They're looking for discretion, and they're looking for minimal disruption in their day, right? So they don't want to have to go wait in a doctor's office, wait for their appointment, see the doctor, and then the doctor sends them to the lab. They go to the lab, they get their labs drawn, and then they have to wait another week to get their results. And a lot of times that means a second visit for their results to be known and scheduled appointment. So how does this look? Well, first, and this is something that's going to be general for all areas of healthcare. One, it's going to be over the counter. So do we move to the ability to purchase our kit over the counter ourselves? And that testing kit could be from the pharmacy directly. At this point, it can be with a prescription that's provided by the provider, or independent, where the patient can go and pick it up themselves. If they're interested in getting a COVID test, for example, they're traveling overseas and they need a COVID test before departure as well as arrival. Will they be able to purchase these kits from the shelves? Big store, box store facilities like your Costco or your Sam's Club, or even your grocery stores, the patient may be able to just go in and purchase their product, and you can actually see some of these products already that are in the market. And then also, can they order it from an app? So everybody carries a phone around, especially the newer generation. Everyone is very tech savvy. You can order your food, you can order alcohol. Why not order your diagnostic testing that you need from your app, get it directly sent to you, and then you return it? Where else do we see the future going? Vending machines. So this is something that we see everywhere. Why not put vending machines on high populated areas where the need might exist? So for example, your airports, your college campuses. These are places that patients can go. They can discreetly order whatever test they need. They walk up to the machine, they pick their test. It comes out in a discreet envelope. No one knows exactly what you're ordering. You receive it, you do your sample, submit it to the lab, and then you get your results after. What about e-commerce? Allowing the patient to order online from either the app or their laptop. And it's another way that keeps confidentiality, but it's also discreet for the patient. 'Cause What we see trending in the future is we want accessibility. So the goal is to have this be accessible to all patients, not only in communities that are underserved, but everyone. So everyone who's available has access to it. It makes it better for the industry, and it allows for the patient to be engaged, okay? We can use this in the preventative setting, so if it's something that they want to find out ahead of time to check for a certain disease process because they are concerned for family history, you diagnose something early or you check on something prior, you can do methods to try to decrease that patient's risk of having a disease in the future. A treatable disease, if you catch the disease earlier, you diagnose it sooner, you have a better chance of having better outcomes and treatment outcomes for the patient. And then lastly, you want it to be affordable, okay? That's the big thing. How much does it cost? Is it less for me to make an appointment and go in versus ordering something online and getting it sent directly to me? Absolutely. Cutting out the middleman, cutting out the insurers, having things sent direct to consumer definitely takes that piece away, so the overall cost is decreased for the patient. And this is important, especially for the gap in our healthcare system where you have the patients who don't have the access to insurance, or they're the underinsured, we call, the ones who make too much money to get Medicaid, but not enough money to afford the larger healthcare plans that are available. This helps to close that gap for those patients who can afford a cheaper option so that they can get the health care that they need. And they don't have to worry about medical bills that can add up. So affordable to all. You know, with governmental efforts to defund a lot of the institutions, one example of that is Planned Parenthood. A lot of the services that were available to our underinsured or uninsured patients is going away. So where do those patients go? They fall through the gaps and end up in the emergency department, and then they have to pay large bills or get sent to collections because they can't afford to pay those bills. So with this ability to have it direct to consumer at an affordable price, the patient has not only the discretion that they desire, but they have a cheaper option, and the convenience of not having to run up bills by going to a physician, but having the ability to talk to a provider should their test come out with an abnormal result. This also goes to our rural communities. You know, this is another area that is of interest to me. I worked in the middle of Ohio. I won't tell you what I called it, but it was in the middle of nowhere. It was part of Amish country. That's a very underserved community that don't utilize the healthcare system. But we know that there's 46 million Americans who live in rural communities who don't have access. A lot of these communities have lost funding for their hospitals. A lot of the hospitals have closed in these communities. The closest town where I was working, the next closest town that had even a hospital that had any type of level other than just an access care hospital was more than 45 minutes away. And so those patients in those towns either didn't get seen or didn't get treated. So something like this, where they have the ability to either go to a community health department or go online if they have access to the technology, they can order their testing, but again, still have the ability to talk to a provider should they need to by telemedicine. So I think that this is another market for technology and health to be combined, and that's where P23 Labs is also looking to try to help partner to reach those communities who need that assistance. So what does this mean? So our lessons from COVID that we've learned is that our industry is being propelled forward by all of the changes, and we saw just from a prior talk how rapid things change. It was almost overnight. Some of the things that happened because of COVID were just exceedingly fast, considering I've done this now for 17 years. It was amazing to see how quickly we adapted. I think that's something that's really important. We have to adapt and be flexible and have forward-thinking ideas and looking at how we can institute those to push medicine forward. One of the things is if Amazon can reach everybody in the country, why can't people in our industry, especially in the healthcare area, why can't we reach out to everyone else just like Amazon? But at the end of the day, we want to focus on the total health of the patient, especially all communities, including our underserved. So how can we be the catalyst of change? Like all industries, again, adapting to the consumer and the consumer needs are important. Okay, that's what we have to look at. Tuning into what we're seeing, hearing, and reading in our industry, and analyzing that is critical to the survival of medicine as well as the survival of technology and industries. And then being mission-based and having a goal to bring healthcare to everyone is paramount. So I think that that's important. So our focus is personal. Our passion is excellence, and our promise is quality. And we're motivated to partner with you, partner with other forward-thinking individuals in this sector. So what's your motivation? Where are you headed? How do you see the future looking? Any questions? Yes.
Thank you for your presentation.
Sure.
Can you hear me?
Yes.
Thank you for your presentation, first of all. My only concern is when it comes to the convenience of, providing lab specimens. How can you confirm the validity and the accuracy of that specimen is coming from the prescribed patient or the patient intended? How would we be able to cover our bases to make sure that whether it's human error or someone is using someone else's secretions or whatever the case may be for that diagnostic testing? But I think it's a great idea as far as to make it more convenient, especially the advancement of technology. I think healthcare has to kind of pick up, especially in the States compared to other countries that were kind of lagging behind in innovation. But then there's also the concern about getting the right patient, the right treatment, the right process, and all those different things.
So, part of it is the client has to have the, they order it themselves, so it's not someone else ordering the test. Now, I don't think you can always guarantee if I order it and my sister gives the sample. I think that is a little bit more tricky, especially when you're looking at, say, you're moving into the direction of drug testing or something like that for jobs. I think that's a totally different area. But for individual testing for certain disease processes, you can't always guarantee that it's not someone else's specimen. However, once the specimen is collected and it is placed into the vial, there is a barcode that is tracked for that particular individual. We have QA or quality metrics that we follow in order to make sure that specimen is processed specifically in an order, how it's supposed to be done. We have multiple step validation in case something does come back positive, so we do have repeat testing in order to validate if that was truly a positive test or not. So there's multiple steps along the line for quality to make sure that test for that individual is accurate. Now, I can't say that we can determine if someone else puts someone else's sample in the box. I would hope that wouldn't be the case, especially for the testing that we're doing, including respiratory pathogens, the STD testing, things like that. I think what's important is that, especially for the women's healthcare side and moving into more of your STIs, that's where the patients want that confidentiality. They kind of want to know themselves. And so I would hope that it would just be their specimen and not someone else. I hope that answered your question.
Very interesting talk, so thank you for this. And I was pretty excited to see that future of healthcare stuff, the diagnostic thing that you were talking about. Can you elaborate a little bit on where do you see the healthcare provider sitting in that entire paradigm that you were saying? Mainly the physicians, the ordering physicians, who are critical right now.
Sure. Well, I think as far as the ordering physician, I think it would be helpful for us, especially in those communities where, in my position, we see a lot of the patients who come in from the emergency department. And so these are patients who've been lost to the system. They have no continuity of care. They have no follow-up. And one of the challenges is making sure that these patients come back. So we see them in an emergency department. We may have to do emergent surgery or see them for some type of disease process. We treat them at that time, and then where do they go? And so trying to help them facilitate either getting into a continuity of care clinic or even following up with us, if it was easier for them to say, instead of driving 45 minutes to come to the office to be evaluated, I can say, hey, just go to Walmart, go pick up this test, send it in. I have access to the portal. I can look at the portal and I'll call you with your results. It just makes it easier for the patient, especially, I mean, we see a lot of patients who don't have transportation. They have to take 2 buses to get to where they're going. They don't want to come back. They get lost to follow up. And I think that just gives them an ease of convenience so that we can try to reach those populations and kind of cut down some of that. Because what ends up happening is you see them bouncing back to the emergency department, or they bounce around to multiple emergency departments because they have no place else to go. So if you have that capability, I think it helps at least fill that gap a little bit.
Thanks very much for your presentation. Have you guys given any thought to what I would call turnkey or hybrid kinds of solutions where somebody is working at home with an online symptom checker program that they have where they've got a cough, and so they click on cough, and then other questions come up, and it is determined by the symptom checker that they have enough of the symptoms to then be put into a COVID-19 surveillance and risk stratification, or it could be symptoms that are going in another direction for another viral disease or a bacterial disease, where this kind of symptom checker program could be connected to a rapid diagnostic testing capability as well. Thank you.
Absolutely. I think that's a great idea, and I think that's certainly something that we are looking to as far as partnering with someone else, because I think that's awesome. Right now, a lot of the surveillance is, before you come in for an appointment, have you had a cough? Have you been exposed to anyone in the last 2 weeks? Have you traveled? What are some of these symptoms? And those people get pre-screened. So I think that's a great idea to have like a pre-screening tool that automatically says, okay, you have these symptoms. We're going to have you do this diagnostic test. If this diagnostic test comes back positive, we'll have you connected to our telemedicine person who will, tell you what next steps have to happen. So I think that that's a great collaboration where you have the laboratory side and you have the facility side to integrate just the technology, so it is a quick method for the patient to at least get assessed. Sure.
So this is a cool idea. How do you get physicians to accept your results since it's sort of home-based without immediately saying, oh, I've got to go back and redo it?
Say, reframe
So
it.
my sense is that physicians are really reluctant to accept the results that they did on tests they didn't order. It seems like that's going to be a bigger problem if a patient self-diagnoses, goes and gets a test, and then has a positive, goes to the physician. Is that just the way it's going to be? Physicians will require to be retested, or will the physician accept?
I think it just depends on those clients who are the outreach that you have with those providers. I think one is going to be education. So working with the providers, getting the information out to them. And just like any other lab, like your Quest or your LabCorp, your big mega, conglomerate labs, gaining the trust of those providers with your data. So, we're all data driven. Doctors are data driven. Show me the data. So I think if you show them the data and discuss with them what the capabilities are, and again, just like the gentleman just said, turnkey, having this analysis where, we're using innovation and technology, like your, what is it? Not your virtual reality. I'm I can't remember the name of it, but your IA or whatever, your artificial intelligence, your AI, sorry, where they can give you a sense of what you need to do and then having that available to the provider. I think it's just an acceptance. I mean, medicine is changing so rapidly. Unfortunately, we still have a lot of dinosaurs in medicine, and there's some things that we don't like to change. We're very stubborn. But I think that in order to move forward, just because the new generation, they want things rapidly. They consume things in a different manner. And so we're going to have to reach out to them. And in order to stay ahead, you're going to have to be more creative because that's what they're looking for. So we have to adapt to in the medical field. Anything else? Thank you. Sure.